In-depth coverage of the top stories and breaking news when it happens. News Radio 1080 KRLD.
Welcome to Ask the Expert North Texas here on News Radio 1080 KRLD. I'm David Rankin.
And I'm Kristen Diaz. And for a lot of you guys, the stress might already be creeping up on you, as this is, of course, the start of the holiday season, Thanksgiving tomorrow, and just the holidays in general. It can really take a toll on your health, your stress, your peace of mind, your heart. Dr. Fahmi Farah says she joins us in the KRLD Zoom room, and just really thank you for your time. As we're just wrapping ourselves up in all of our to-do lists this week, but I think this is a really important message. What is holiday heart?
So holiday heart it consists of a couple of different things. It just means people who during the holiday season take excessive amounts of salt or alcohol related problems, they can push them over to having heart disease. So for example, people who have congestive heart failure that already pre-existed, this can now push them over and they can end up in the hospital with acute congestive heart failure with shortness of breath, a lot of swelling, so they can actually end up in the hospital. Similarly, a lot of times people can actually have heart attack during this time of the year with, as you mentioned, stress, unhealthy eating, several factors involved here. And so that hospitalization rate actually goes up during this time with really serious things like heart attack and congestive heart failure.
Talk about the instance of the fact that alcohol plays such a huge part of holiday heart syndrome.
Yes, alcohol, is a major culprit actually during this time because studies have over the years, studies have shown that no amount of alcohol is good for our heart. And, generally speaking, moderation, we tell people moderation is okay, and abstinence is, of course, the best. But during the holiday season, people tend to drink a lot more. So that excessive alcohol consumption can totally push them over the edge. And it's not just heart, it's other organs too that are affected. The liver, for example, people can go into acute liver failure as a result of excessive alcohol consumption. And alcohol in general destabilizes the heart and the cardiovascular system, and it actually can weaken the heart muscle and can cause heart failure in those who are excessively drinking alcohol.
And let's talk about this. I mean, there's a lot of reasons why people are driven to drink. It might be to celebrate the season, but for some people, it might be grief. The holidays are really, really hard. And despite the fact that we're talking about specifically holiday heart, another nickname for something, broken heart syndrome. This is a really, tough time for some people who maybe don't have their loved ones around when everyone else does.
You're absolutely correct. This is that time of the year. It's supposed to be a very joyous time of the year, when families come together. But there are many, many people who don't have that. And that loneliness sets in. And with that comes depression and mental health problems. And it can push somebody to look into unhealthy coping mechanisms like alcohol. And alcohol is actually one of the biggest ones for that. And so that alcohol intoxication can, again, push them over the edge, and they can truly get into trouble by getting into serious conditions like heart attack, heart failure, stroke, all sorts of things, and can end up in the hospital.
So what does holiday heart syndrome feel like? What symptoms should people be looking for?
The key symptoms would be shortness of breath, swelling of your legs, and chest pain. Those would be three key things to look out for. Some stroke signs would be inability to speak, suddenly having weakness of one side of the body, or drooping of the face. Those are all signs of really serious medical conditions, and you should really call 911 and seek help.
Yeah, a lot of people during the holidays, they also try to avoid the emergency room. They try to put it off as, I'll be fine. At what point how can you convince somebody to get checked?
I couldn't agree more. Yes, during the holiday season, a lot of people tend to avoid the hospitals just because, some people and most people do have family around. They're just busy. And even if they have signs and symptoms, they tend to ignore it, and they feel that, I'll just go tomorrow. I don't want to miss the holiday. Absolutely not the right approach. if you have these signs that I just mentioned, you should call 911 and you should seek help, regardless of how busy the hospital may be. So that's the best advice I can give.
Let's talk about other issues during this particular time of year that people need to watch out for, and what behaviors people should be doing or not doing.
One of the things people tend to do during the holiday season, because they're stressed, they're busy, and sometimes they're traveling, they become non-compliant with their medications. So this is for people who already have pre-existing conditions, either diagnosed heart disease, or they have risk factors like high blood pressure, high cholesterol, diabetes. Very, very important to stay compliant with your medications. Don't skip your meds. The other thing I will say, and this is for everybody, is people tend to deviate from their usual routine. For example, exercise, eating healthy, getting good night's sleep. Those are all very important, and you should not deviate from those, because those are the things that can really push you into getting into trouble, like having a heart attack.
Can we talk about some heart healthy habits to have this holiday season, like maybe going out on a walk, just kind of get away from the stress, or to de-stress, or other things like that?
Oh, absolutely. Always maintain the healthy habits. Walking, especially walking outdoors, could be really good for both your cardiovascular health and mental health. So don't give up on exercise. And, stress management is so important. Stress is one of the risk factors for heart disease. And so just set the right expectations. I know financial stress is a big stress because you have to buy gifts for everybody. So set the right expectation with your family members and friends, and with yourself. Give yourself enough time, adequate sleep, stress management. Don't smoke or drink. All those would be really great heart healthy habits to keep up with.
Let's talk about right after the new year. People will be making New Year's resolutions of all kinds, and sometimes they tend to go a little bit overboard. What's the risk to our heart health with New Year's resolutions?
I tend to think New Year's resolution is a good thing if you're making good resolutions. Like a lot of people say, okay, for my New Year's resolution, I'm going to work out every day. That's a good one, right? So I say, like, make healthy New Year's resolutions, and don't go overboard, as you mentioned, David. Just keep it in moderate range to where you can actually do it. Like, keep your daily schedule and your routine into consideration, and make goals, small, doable goals that you're not going to give up on, so that you see yourself achieving those goals. And that's an encouragement. So you just keep going. So setting realistic expectations and goals is very important.
Dr. Fahmi Farah here on the KRLD Afternoon News. Thank you so much for your time today. We appreciate all of your guidance.